Good morning. My name is Dr. Megan Kamath, and I'm one of the advanced heart failure and transplant cardiologists here at UCLA Health. I wanted to take a minute to thank you for tuning in to our webinar today. And our topic for this morning is heart failure, what you need to know. So let's get started. Before we delve into the topic, I wanted to remind you that you are welcome to ask questions on Twitter using the hashtag UCLAMDChat, or even comment on Facebook as well. We look forward to hearing your questions. So we have a lot to cover and not a lot of time, but I'll do my best to get through this all. So what are we going to talk about today? We're going to talk about what is heart failure. What are the common symptoms of heart failure? What are the causes of heart failure? What we might do as physicians or medical providers to diagnose heart failure? What are some treatment options that are available for heart failure? What you as a patient can do? And what UCLA expertise we have available in the heart failure arena as well. So let's go back and start with the basics. So I bet you all remember from your science class, maybe several years ago for some of us, that the heart is the muscular organ that pumps blood to the rest of the body via the blood vessels of the circulatory system. And if you look here on this diagram, there are four main chambers of the heart. There's two chambers on the top, and they're called atria. They're the receiving chambers that receive the blood. There's two chambers on the bottom, which are called the ventricles, and they're the pumping chambers. And the left ventricle is the ventricle that pumps the blood to the rest of the body via the aorta, while the right ventricle pumps the blood to the lungs. So when I get asked in the office, what is heart failure? A lot of patients come in thinking that heart failure means that your heart has stopped. And actually, heart failure is a condition where the heart muscle has become injured in some way and loses its ability to pump blood effectively to the rest of the body. Why is it important to know about heart failure? Well, for number one, it's becoming more and more common. It's a progressive condition, and it affects more than 6.5 million Americans today. And that number is projected to increase to more than 10 million Americans by the year 2037. It's the number one cause of hospitalizations in the Medicare population, so it affects a wide range of ages. And the anticipated cost of heart failure is predicted to be over $60 billion by the year 2030. So the chances are is you're going to know someone with this condition, or you may be affected by this condition yourself at some point down the road. So there are several reasons why you can develop heart failure. Some of these reasons may be acute, which means they occur very quickly, while others may be more chronic, meaning that they occur over a longer period of time. What are potential causes for heart failure? Well, some common ones may include a previous heart attack, or you may hear the term myocardial infarction, uncontrolled high blood pressure or hypertension, coronary artery disease, or blockages in the heart arteries, heart valve disease, or even heart rhythm disturbances as well. Heart failure may also be caused by some congenital heart defects, meaning conditions that you were born with, conditions that cause inflammation of the heart muscle disease, substance use such as alcohol or drugs, and even pregnancy-related heart failure, which you may hear the term peripartum associated with that. So, what types of heart failure are there? Most commonly, you may hear about left-sided heart failure and right-sided heart failure. You may also sometimes hear the third term, biventricular heart failure. And now I'm going to go into a little bit about each one of those. So what is left-sided heart failure? So thinking back to the slide that I showed at the beginning, the left ventricle, the main pumping chamber of the heart, cannot work effectively in left-sided heart failure. And when we think about left-sided heart failure, we define it in really two main categories. One being systolic heart failure, where the left ventricle lacks the force to push enough blood into the circulation. And then we talk about diastolic heart failure, where the left ventricle fails to relax normally because the heart muscle is stiff, and so the filling of the heart chamber is impaired. When we talk about right-sided heart failure, we're talking about that right pumping chamber, or the right ventricle, which pumps blood to the lungs. And in right-sided heart failure, the right ventricle is compromised. This can be related to a heart attack that is localized to the muscle of the right ventricle. It can be related to damage to the valves in the right side of the heart, or even elevated blood pressures in the lungs. When we talk about the term biventricular heart failure, it simply means that both the ventricles, the left ventricle and the right ventricle of the heart, are compromised and cannot work effectively. So I wanted to go through some of the common symptoms now that you may see with either type of heart failure and take a few minutes to elaborate on those a little bit. So with left-sided heart failure, some common symptoms may be related to your breathing. Maybe you notice that there's a cough, or crackles, or wheezing. Your breathing may seem faster than normal, a condition that we call medically tachypnea. Your heart rate may be faster, a condition that we call tachycardia. You may have shortness of breath or dyspnea that is worse with activity or exertion. You may notice that you have trouble breathing when you're laying flat, or orthopnea, or trouble breathing that wakes you up in the middle of the night, a condition that we call paroxysmal nocturnal dyspnea. Now with right-sided heart failure, you may have some of those symptoms that you had with left-sided heart failure, but you may also notice that your belly is enlarged. You may have complaints that are related to not being able to eat as much, or anorexia. You may have swelling in the legs, known as dependent edema, and you may notice weight gain as well. So here I've summarized some of the common symptoms that you may see with both types of heart failure. Number one being shortness of breath, next being a cough, often dry and worse at night, poor appetite, nausea, fatigue, leg swelling or edema, as I mentioned before, and even the increased abdominal girth. So a common term that you may hear associated when we talk about heart failure is the term ejection fraction. And now this is going back to math class and those fractions that everyone hated to learn about. So this is a term that compares the amount of blood in the heart chamber to the amount of blood that is pumped out. So looking at this diagram here, the amount of blood in the chamber is your denominator, and the amount of blood that is pumped out is your numerator. And when you calculate that, you get an ejection fraction, which helps us to determine how well the heart is pumping. Let's delve into a little bit more about the ejection fraction. So, as I said, it refers to how much blood is pumped out. In a normal scenario, about 50 to 70% of the blood is pumped out during each contraction. And usually in patients that have this type of an ejection fraction, they're comfortable doing their activities of daily living and they're able to do so without symptoms. Now let's say your heart function is somewhere in that 41 to 49% range, a range that sometimes we call borderline. You may notice symptoms that are noticeable during activity, like walking your dog, for example. Now, when your heart function is reduced, meaning that less than 40% of the blood is pumped out during each contraction, you may have noticeable symptoms both at rest and with activity. It's important to also note that there is a class of patients who have heart failure but have a normal ejection fraction, and that's called heart failure with preserved ejection fraction. For the sake of time today, I'm not going into that in detail, but I wanted to make that point as well. So when you come to see your doctor to be evaluated for heart failure, what are the things that we might talk about with you? Well, number one, we start with a history. And the history will include us asking you about your risk factors for heart failure. Those things that may include your age, family history, social history, were you ever a smoker? Did you use alcohol, any other drugs? What did you do for a living? Your duration of symptoms, how long have they occurred? What were you able to do before that you're not able to do now? And that sort of ties into the physical activity part of it. What are you limited by? And what kind of things would you like to get back to doing? So this is a very comprehensive part of our evaluation. We then will turn to a physical examination, and that will include things like measuring your blood pressure and your pulse, assessing your skin color and its warmth, checking the veins in your neck. The reason why you would see us checking the veins in your neck is that if blood is backing up into the heart, your neck veins will often be bulging or swollen. And that's something you may not see commonly in other physical examinations, so I wanted to bring that point up here with respect to our heart failure exam. Certainly we're going to listen to your breathing and your heart with our stethoscope. A crackling sound of the lungs or some wheezing may indicate that there's fluid accumulation in the lungs. And similarly, abnormal heart sounds like a murmur may clue us into some valvular defects. We'll check your abdomen for swelling that's caused by fluid accumulation and check your ankles and legs for swelling as well, and we'll measure your body weight. So once we've done the history and the physical examination, it's now time to talk about what other tests we may do. Some common tests that you may have ordered when we're working up heart failure include an electrocardiogram or an ECG. That is a picture of the rhythm of the heart, and with it we're able to look for evidence of heart attacks or heart strain, and evidence of heart enlargement can be seen on that as well. We also would likely order an echocardiogram, which is an ultrasound of the heart, and it allows us to get a closer look at the heart muscles and the heart valves. So here, this is an ultrasound image of the heart where you can see the two ventricles here and the two atria here. And it allows us to get a more detailed picture of what may be causing some of the symptoms that you may be having. Other testing that we would be considering includes blood testing to look at your electrolytes, your potassium, your magnesium, your kidney function, liver function, maybe also looking for other underlying causes of heart failure, as I discussed before, and even a chest x-ray to look at what the heart and lungs look like as well. Once we've done the basic testing, then we can decide whether we need to do any more advanced testing, and that may include imaging tests or procedures. Some common ones that you may hear about include nuclear medicine testing, cardiac magnetic resonance imaging, or MRI, exercise testing, cardiac catheterization and angiography, which is where we look for blockages in the heart arteries and may also measure the pressures inside the heart, and even a computed tomography or CT scan to look at the heart and lungs as well. So once you have been told that you have heart failure, what are possible treatment options that we may use? Well, there's a number of different treatment options. One of the common ones that we would start with is oral medications. And it's important to know that there are many types of oral medications that we may use. And each medication may have a different target or mechanism of action. So some medicines that we use reduce the workload of the heart and try to strengthen the heart muscle, while other medicines may be used to reduce fluid accumulation and congestion. Still more medications may be used to treat the heart rhythm disturbances. Other ones may lower the blood pressure and reduce the resistance in the blood vessels, making it easier for the heart to pump. And then the newer classes of oral medications actually block the effects of hormones that can cause heart failure to get worse. In conjunction with oral medications, we often will talk to you in the clinic about dietary modifications. Things like a low sodium diet, staying under 2 grams of sodium in one day, and restricting your fluid intake. That's usually staying under 2 liters or 64 ounces of fluid in one day, are mainstays of the dietary modifications that we would recommend. Certainly also the low-fat, low-cholesterol, heart-healthy diet, blood sugar management for diabetes is very important as well. And in conjunction with the oral medications and the dietary modifications, we may also consider using cardiac rehabilitation, which is a supervised exercise program run under the guidance of an exercise physiologist, also to strengthen the heart muscle by trying to increase the activity that one is able to do. When heart failure is more severe, we may have to turn to some IV medications as well. These medications may be used to treat fluid accumulation, but may also be used in a longer-term perspective to improve the contractility or pumping function of the heart. We may also use these medications to reduce the workload of the heart and make it easier for the heart to pump. In conjunction with our electrical heart doctor colleagues, we may consider device therapy, and that includes things like a pacemaker, which monitors the heart rate and sends electrical impulses to the heart as needed to maintain a normal heart rate. You may use an implantable cardioverter defibrillator, which is a device that monitors the heart rhythm. And if it senses a serious heart rhythm problem, it has the capacity to deliver an electrical shock to the heart to correct this problem. We may also use something called cardiac resynchronization therapy, or CRT, which, similar to a pacemaker, re-coordinates the beating of the 2 ventricles to try to strengthen the heart. When heart failure is really severe, we may also use mechanical circulatory support. These are temporary or durable devices that can be used to help the heart pump more effectively. One type of device that you may hear about now more commonly is called a left ventricular assist device, or an LVAD. I'm going to show you a schematic here of what an LVAD looks like. So blood enters the heart from the left atrium, goes through to the left ventricle, and then enters the device from the ventricle. A rotor inside the pump creates a continuous flow of blood, and then the device pumps the blood into the aorta and through the rest of the body. The pump is connected via an external drive line to a system controller, which is powered by a battery. So this is some pretty impressive new technology that's been coming up over the last several years. Another type of new technology that we may use is called a wireless pulmonary artery monitor. This involves using a tiny sensor implanted via catheterization procedure into the pulmonary artery. And once the sensor is implanted, it measures the pressures inside the pulmonary artery. These consistent pressure readings can be used to help patients stay out of the hospital by allowing the healthcare team to adjust the doses of medications and instructing the patient to watch their diet and fluid intake more closely. We may also use surgeries to help manage heart failure patients in conjunction with our cardiothoracic colleagues. Those may include coronary artery bypass grafting, valve surgeries, which may include valve repairs or replacements, and for those patients who may not be candidates for open heart surgery, we may be able to offer them percutaneous or minimally invasive transcatheter valve replacements or repairs. And UCLA is one of the leaders in this with respect to the aortic valve and the mitral valve. As a last resort, we often use heart transplantation. And I put this slide in here from the International Society for Heart and Lung Transplantation to show you that while the number of heart transplants has increased since 1982 until now, which you can see here 1982 and then here closer to the more present day, there are still limited resources with respect to the availability of hearts. So we have to use this judiciously and sparingly and in the right patient population as well. So now that you have an overview of heart failure, what are the things that you can do as a patient to learn more and empower yourself? Well, first of all, you should seek medical attention for any symptoms, which can often be nonspecific. So, time to go and make that appointment with your doctor. You should follow the instructions of your medical provider when it comes to medications and testing that has been ordered or suggested. You should educate yourself to learn about these conditions, just as you've done today by attending this webinar. And you should seek out a center with heart failure expertise. UCLA in particular, as you all I'm sure are aware, has state-of-the-art technology, physician resources, medical team resources, and we're a leader in clinical trials and research in the heart failure and cardiology arena. I wanted to take a minute here to let you guys know that our heart failure program is expanding. We not only see patients in Westwood, but we're also expanding to locations close to home and near you to make it easier for you guys to see advanced heart failure specialists like myself. Right now we have locations in Thousand Oaks, Torrance, and Santa Clarita, and we're hoping to expand further in the coming months. And if you'd like to learn more about heart failure, about state-of-the-art updates and therapies in the advanced heart failure realm, as we've just touched on the surface today, I invite you guys to all attend our Heart Failure Symposium. This is going to be on May 18th at the Marina Del Rey Marriott. You'll get to meet myself and other members of the team that we work closely with, and you'll get a chance to learn about the latest and greatest updates in heart failure and research. So with that, I believe we have some questions. Okay, so let's start with the question, shortness of breath and fatigue is common as I age, so I should just deal with it, right? So the answer to that is that you should always talk to your physician about any new and different symptoms that you may be experiencing, so that they can be explored further through history, through physical examination, and through further testing as needed. Another question that came up was, if I have heart failure, I'll never be able to go back to doing the things I was doing before. Actually, we have many patients who are able to do more than what they were doing before their diagnosis and can go on to live full and productive lives. So again, the importance of seeking out medical care and being an advocate in your care cannot be understated here. Another question here are, if I've already had a heart attack, there's nothing I can do to reduce my risk of further heart events. The answer to that is yes, there is. There's a lot you can do. Things like eating a heart-healthy diet, checking for diabetes, stopping smoking, controlling stress, controlling blood pressure and cholesterol, and exercising as directed by your physician. Another question that we got is, what is a possible cause of heart failure with a normal ejection fraction? Well, that's a good question. As I mentioned before, the heart failure with a normal ejection fraction can be as a result of the heart muscle being stiff and being a challenge to relax and having impaired filling of the heart chamber as a result of that. So there can be many causes for heart stiffness that would need to be looked into in that case. And I think with that, we will end our webinar for today. We're happy to take more questions on Twitter and get back to you offline, but I wanted to thank you all for tuning in to learn about heart failure and what you need to know.